So, without further delay, I'd love to introduce our speaker for today. So, today we have with us Rebecca Barrett. So, Rebecca is a clinical social worker at Mount Sinai Hospital in the Christopher Sharp Cancer Center in Toronto. She has a Master's of Social Work specializing in mental health and health at the University of Toronto. And she has experience working with individuals with cancer and their families, both in the hospital setting at Princess Margaret Cancer Center at Mount Sinai, and in the community at Gilda's Club Greater Toronto. Her social work career, she specializes in oncology as well. So, with that, I'm very pleased to pass over the floor to Rebecca for today.
Thank you so much, Vinitha, and thank you so much to everyone who came to the talk and registered. This is a topic that I'm very excited about. And I apologize if there's any tech issues as we're even doing that intro. My next button seems to be sticking, so I will try to navigate that the best that I can. But I'm very, very excited to be talking to you a little bit more about imagery and how you can use that throughout the cancer experience. I first started exploring imagery, and it was actually with my own therapist. And I saw the benefit in my own personal life, and just the shifts in my thinking, the shifts in my physical body and the way I was responding to various stressors. And I decided that I wanted to do more training in imagery. So I did some training programs through the Academy for Guided Imagery, and that is located in California. And since then, I have been using this methodology with various patients that I see in the hospital. And I've firsthand heard about how positive the experience has been in using imagery as a way to navigate the experience. Talk therapy more so focuses on the narrative around the thoughts and feelings. And imagery is a unique experience of using the imagination to explore one's thoughts, feelings, behaviors, and working at the subconscious level. So I'll be doing more of an introduction as to what is imagery, how does it work, and towards the end of this presentation, I will be guiding you through a guided imagery experience. And before formally starting today, I also wanted to provide a land acknowledgement that my dear friend who is Métis actually helped me to prepare for today's presentation. As a descendant of settlers, I believe I must acknowledge the ancestral homelands we are meeting on today, and I myself am located in what is now called Toronto. This land is the traditional territories of many nations, including the Neutrals, Attawatandrans, the Huron-Wendat, the Anishinaabe, the Mississaugas of the Credit, and the Haudenosaunee. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, including First Nations, Inuit, and Métis. With honesty and respect, we do this to lift up the sacred diversity of the original First Peoples, caretakers of this land that we live, work, and thrive on. I want to take this time for this land acknowledgement as it is essential to remember how we as settlers got here, to acknowledge land, traditions, languages, and culture that were taken from Indigenous people due to colonialism, and for the horrible acts of genocide that the Indigenous peoples previously experienced and continue to experience today. As a settler myself, I am committed to unpacking and unlearning colonialism and white supremacy. Together, we do this to reaffirm our commitment and responsibility in reconciling and improving relationships between nations. Let's move forward with humility, respect, gratitude, and meaningful relationship building. As my best friend, Marcel, who is Métis, would say, Miigwech. Thank you. And before starting, every morning I pick an affirmation card, and they are Louise Hay's thought cards. And I picked one for today's talk that I thought would be nice to share with the group. So I am connected to all of life. I am spirit, light, energy, vibration, color, and love. I am connected with every person on the planet and with all of life. If you're interested in the thought cards, you can get them from Amazon, Indigo, but they're just a really nice way to start the day. And the messaging from this one is talking about connection. So I'm really looking forward to connecting further with you all. So imagery is all about visualization. It's using direct suggestions where someone is guiding you through the process and using images, metaphor, and storytelling, either from the standpoint of the facilitator providing these images that you're then creating in your mind, or you yourself are coming up with that content. So it does go past the surface level and focuses more on the unconscious mind through the use of the imagination. As most of you are probably familiar with imagery, guided imagery is when the facilitator is guiding the participant through a scripted visualization exercise. So looking at the picture here of the waterfall, the facilitator might be exploring this image through the use of the senses. And so they actually wouldn't provide you the picture because they would want you to create this image in your mind on your own. So they might be asking you to explore the sunlight on your face, feeling the warmth on your face. What does the water feel like? What does the foliage and the waterfall smell like? What do you hear when you're amongst the trees, the running water, creatures in the forest, and using the various senses to help guide you through this imagery that you're then creating in your mind. Interactive guided imagery is an approach that was created by and taught by the Academy for Guided Imagery. So this is where I learned more about it. And the difference between interactive guided imagery and typical traditional guided imagery is there's an interactive component. So rather than someone reading a script and the participant coming up with the images in their mind, the facilitator is asking open-ended questions and you're coming up with the content. You are letting the facilitator know and verbalizing what you see in your mind's eye. So this is all about using the participant's imagination. And in doing this, if you're exploring a particular topic, such as a difficult decision, or potentially when you're first diagnosed, and the stress and fear that comes from that situation, it helps you to gain more clarity about what the root is to those feelings through this open-ended questioning. So it helps people tap into their own resources. So you're coming up with the content and you're actually coming up with your own solutions to these problems, or solutions to processing these really difficult experiences and emotions that come up, and finding ways to actually offer support to yourself. And so in talking further about interactive guided imagery, I'm going to tell you a little bit more about where it comes from, what the benefits are based on research, but then actually thinking about how these can be utilized on your own, where you don't need to be led by a facilitator. You can actually think about strategies that you can come up with and produce on your own. And it helps people to find a sense of meaning in what they're doing and what their experience is. What is a lesson to be learned, or finding a more either neutral or positive way of being able to relate to your experience. And it differs from hypnosis in that hypnosis requires the person to fall into a more trance-like state, so a very deeply relaxed state, to the point where they are more open and responsive to suggestion as they're being guided. Interactive imagery doesn't necessarily require hypnosis, although they can work in tandem. It is encouraged that people are in a more relaxed state when they're engaging in imagery, but they don't need to necessarily be open to suggestion because they're actually the ones coming up with the content. So the imagery research, specifically in terms of working with imagery and physical health, started in the 1970s, and it was done by the work of Oyl, the Simontons, and Assagioli. And they studied imagery in relation to cancer, chronic pain, immune dysfunction, heart disease, and other life-threatening illnesses. What they discovered was that there was a lot of physical benefits to this, as you can see based on this list. So improvements in terms of respiration, heart rate, blood pressure, gastrointestinal mobility, sexual function, cortisol levels, immune responsiveness, and metabolic rates in cells. So in terms of the physical benefits, although imagery is not, as you know, going to cure cancer, it can help with your general physical functioning while going through cancer treatments or in the recovery stages of cancer. They also found there to be plenty of psychological benefits as well. So it helps people to discover a more self-awareness around their experience. So self-awareness around what are their thought patterns that come with the diagnosis? What are the emotions that come up during difficult and stressful events? It helps people to gain a sense of independence and autonomy in the sense that they themselves, again, are coming up with that content. They are active participants in their experience. It helps them to discover and to develop a sense of self-worth. So a more positive relationship to self, a more healthy relationship to self, and helps them to develop self-care strategies and coping strategies through the use of these various imagery techniques that they're then able to actively engage in their everyday life. And with all of this comes a sense of empowerment, the fact that people feel more in control of their situation in terms of their own emotional regulation, and trying to create a more regulated sense of self during very, very stressful events. And I think it's important to note the goal of imagery is not to ignore negative emotion. It's not realistic to say, let's look at the silver lining, let's be positive. Imagery is not about that. It's about acknowledging and coming up with images with the difficult feelings and seeing if there's ways of being able to shift them into more helpful and more pleasant experiences. But it is about gaining that awareness. That first step is that awareness around the stress of the physical body, the emotional body, the psychological body. And ultimately, imagery was found to also be helpful in terms of decision making. And this can be with exploring images and helping to decide about what next steps to take in terms of your own healing. And when you hear the word healing throughout this talk, I don't want it to be mistaken with the idea of being healed from cancer. So imagery is meant to be used in conjunction with medical treatment, not instead of medical treatment. But it can be a very, very helpful thing to use just for your overall well-being. So what imagery does is it helps us create a picture of ourselves. In using various images, and when you think about words that either you yourself would use to describe yourself or other people would use to describe yourself, I'm sure most of you can come up with concrete images of these various words that people would use. It helps shape our perception of the world. So if we're focusing more on the unhelpful images in our lives, or the images that we create, it's going to shape how we perceive the world, and perceiving the world with more unhelpful, negative images. So imagery helps us to be able to shift those if we wish to do so. It helps us understand what we feel we deserve, and it also helps us anticipate what our future will look like. So I'm sure most of you, especially when you think about, yourself in early childhood and someone asks you, what do you want to be when you grow up? As a child, you create a very concrete image of what that person looks like. Maybe it's someone in a physician's coat. Maybe it is someone, you know, in a police uniform. Maybe it's someone working at a desk, or maybe it's someone working with a paintbrush. But we create very concrete images of what we anticipate our future to look like. And it also helps us understand our motivation to take care of ourselves and how motivated we are to take care of ourselves. So when we think about how imagery can be used during the process of living with, recovering from cancer, it helps us understand what the attitudes are about illness. So again, during that initial diagnosis phase, what I hear from patients is how understandably anxious they are, the anticipation of side effects if they're starting chemotherapy, or body changes with undergoing surgery. And it helps to understand what the attitudes are about going through those various procedures. It helps us to understand what our mindset is, and knowing that the mindset is fluid. People, you know, who resonate with words like strength, resiliency, there are going to be times when you may not feel as strong, you may not feel as resilient, but knowing that that's fluid, that it can change, that you can regain those skills that are always within you at any time. And imagery helps to be able to pull out those strategies and those ways of being. It helps people understand what will and won't get them through treatment. So for some people, when they think about going through chemotherapy, they might visualize their support network surrounding them at the chair side. Obviously not, sadly, during COVID, during the pandemic, but they're able to visualize what that looks like and that support around them. That's a very helpful image to think about. And imagery would encourage to amplify that image and use it as a support anytime during your treatment. And it also helps people understand what won't help them get through illness. So for instance, if someone's anticipating going to work, they may choose not to tell people about the cancer in their workplace because they can visualize an image of being bombarded with questions and being overloaded. So that might help them decide, oh, I think informing everyone at my workplace actually wouldn't be helpful for me. That would actually be really overwhelming for me. So let me think about who I can tell my cancer journey to in order to get some support. And it helps people view their outcomes from illness. So a really helpful image throughout the cancer experience might be visualizing yourself with that sense of strength, vitality, health, creating the image that you want to create for yourself to help shift that affective state. So how you're physically and emotionally feeling about yourself. I think at the beginning of the experience, people think about going through treatment and they visualize someone who is frail, bedridden, having lots of adverse side effects like vomiting, nausea, stomach upset, in pain. So can that be looked at, acknowledged, but looked at also from a counter image of how do you want to see yourself? So although you might be living with cancer, although you might have low energy and might be feeling unwell, what's an image that you can bring to mind to create more of a holistic and helpful and supportive image for yourself? And so later on in the presentation, I'll be talking about specific strategies that you can apply to help create these more helpful images and help reframe some of the more challenging images that you might create for yourself, which of course are still absolutely valid and need to be acknowledged. And in this whole process, because we're using the part of the brain that taps into the unconscious, it helps to get to the root of the issue. So a lot of people with any stressful life event get stuck in the narrative, and sometimes the narrative may not actually be accurate, but it helps people to work towards the a solution by understanding what's actually underneath all of this. So for someone who has immense anxiety about their diagnosis, the root might mean, you know, I don't want to be a burden to my family. That might actually be the root of what is so distressing to them. I'm just going to take a quick water break. Bear with me. So, as most of you are probably aware, imagery is often used for physical and psychological relaxation. It's also used for emotional regulation. So if you're feeling more anxious, fearful, overwhelmed, stressed, it can be used as a technique to help create more of a sense of equilibrium, so more of that sense of balance. And it may help shift you from a more unhelpful feeling, but it also might not. And if it doesn't, that's okay. But it can be used to offer a sense of support while you're grappling with really difficult emotions or difficult thoughts. It can help to ease anxiety and depression, knowing that it may not cure, and the intent would not necessarily be to cure, but it may help ease some of that experience. And some of that physiological sense of self that comes with anxiety and depression. It helps people to manage unhealthy habits. And so that might be alcohol use, tobacco use, comfort eating. So imagery has been used to help manage and navigate kicking some really difficult habits. And what I think is most pertinent to the people that are viewing this presentation is that it can also be used to help prepare for surgical and other types of medical procedures. And again, later down in the presentation, I'll be talking about specific strategies that can be used. And what's beautiful about imagery is that it can be used at any time. You carry your brain around with you, you carry your imagination around with you. So these tools and skills are accessible to you at any time. So imagery acknowledges and works with the concept of whatever you give your attention grows. So understandably, if someone is anticipating a CT scan and there's a lot of anxiety around, what does this mean for me? What does this mean for my future? What if, and visualizing and thinking about all the negative possible outcomes that might happen, which is realistic. And I think most patients, if not all patients, go through this at some point. So it's a completely normal part of the process. If you focus your attention on these things, on the things that create a sense of worry, they tend to magnify. It's like you're zooming in with the magnifying glass on these issues. So if we can start to reframe some of those negative situations and focusing the attention on images that are actually from a place of strength, from a place of resiliency, looking at past experiences that you might have been through and hardships that you would have gone through, and utilizing those skills and creating images around those skills that you want to have in this present moment in navigating all of that stress. That is the focus of imagery. Zooming in on the places within yourself that bring about the sense of resiliency and strength. And as mentioned, used in conjunction with medical treatment, not instead of medical treatment. So spending a bit more time talking about the interactive guided imagery, I'm going to talk to you more about the specific techniques that you can use and apply on your own. I'm going to talk about some case examples and some imagery exercises that I've done with patients that they've shared their experience with me anonymously, and shed some light on how you can use these strategies on your own. And before we do that, I think it is really important to focus it's important to be in a relaxed state before using imagery exercises. If your nervous system is already overstimulated and in that fight, flight, or freeze response, you likely won't benefit from imagery. So what we need to do first is regulate the body, calm the body, and then practice some of these strategies. So how I typically start imagery exercises with the patients that I work with or the caregivers that I work with is tuning into the breath and taking 3 breaths in through the nose, out through the nose. In doing that, sometimes patients might feel overwhelmed with focusing on their breath. And that could be dependent on body image, the site of the tumor, the nature of their cancer. So taking a deep breath might actually be triggering. So if that is the case, don't do that. Do something that's going to be most helpful for you. I find one strategy could mean placing a hand on the belly, placing a hand on the chest. You could even offer yourself a sense of comfort just by holding yourself, but something that you can do that you know is going to create a sense of relaxation in the body. You could even do a brief meditation beforehand, or even just closing the eyes if that feels comfortable and having a quiet moment before you start. And it's also really nice to end the exercise with these strategies. So insight-oriented imagery is when you're bringing to mind an image that symbolizes what you're going through. So you might be visualizing a situation, you might be visualizing a symptom, you might be visualizing a feeling, and being able to create a vivid image in your mind in terms of what that looks like, and exploring that image in order to gain more information about what that image is trying to tell you, what that symptom, feeling, situation is trying to tell you. And so looking at the images here, I had a patient who had told me that her depression felt like falling through a black hole. And at the top of the hole, she was looking up and all her family members were around the hole looking down. And she was so scared and so worried about reaching up for help from the family members that she just let herself fall, because her biggest fear at the root of this was bringing her family into the depression with her, sucking them into the depression. The imagery of the rain cloud was for a patient who was describing her grief, and it felt like a rain cloud that would follow her around that she couldn't seem to escape. Some people visualize their anxiety as being a knot in the stomach, and I'm sure most of us are familiar with that feeling when we're feeling anxious or overwhelmed. Excuse me. They visualize that knot in the stomach. So being able to visualize that knot in the stomach and find out more information in terms of what is the knot about, what is it trying to tell us. Other people described their sense of overwhelm as being a weight pressing on their chest, almost as if it was suffocating, like they couldn't breathe. And another patient described her general response to going through cancer treatment as feeling as if she was stuck in gum. Anytime she tried to resist the gum, trying to get out, she fell deeper and deeper into the gum. So ways of working with some of these images with the patient who described the knot in the stomach, what we did was thinking about loosening that knot. So tuning into the physical body and having the patient close her eyes and actually visualize the knot slowly undoing and breathing more space into that area. So sometimes imagery can be used in conjunction with working with the physical body. With the weight, we visualize the weight slowly creating more space. Slowly lifting away from the body in order to create more space for how she's generally feeling. And with the gum, trying to think about how can I get out of this gum? And ultimately, the root of that came down to just needing to let go, to be still. When she was still and she stopped fighting the experience, the gum slowly left her body and she was able to get it. With the image of the rain cloud, even being able to just ask the rain cloud more about why it needs to be there. And in dialoguing with the rain cloud, it was determined that the rain cloud actually didn't need to be there. It openly explained to the patient, I don't need to be here. And so the patient then asked the rain cloud, I'd like you to please leave because you no longer serve me. I no longer need to feel this way. I've worked through my feelings and I no longer need your presence. And although this might sound a little bit out there, either with the help of a facilitator, someone who's guiding you through this process, or being able to just do this on your own, it can be really, really powerful and help people find out more information in terms of what's going on. So questions that you might think to ask are, what is this image trying to tell me? What does it need me to know? What do I need when I think about my relationship with this image? What can I do to alleviate the physical impact this is having? So the tightness in the chest, the knot in the belly, or the weight on the chest. What can I do to alleviate this tension? And in asking these questions, your subconscious will come up with the answer. It will give you some insight, hence insight-oriented. It will give you some insight in terms of what you need to help get through this situation or this feeling. And what can also come up during this type of imagery is you might realize that the anger with, let's say, the cancer diagnosis, it actually is showing up as your 5-year-old self that's having a temper tantrum and is just so scared of being alone. That might be at the root of everything. So inner child work definitely comes into play with imagery and working with this part of yourself, this inner child that's showing up in your present day life. The inner sanctuary exercise, I actually came across during a yoga class. The yoga instructor had instructed us to tune into our inner sanctuary and explored it using the 5 senses. And so the image that I came to mind was the images at the very bottom. So this lush greenhouse. And so in using this image, I thought about what I saw. So the lush green of the plants and flowers, the beautiful fountain and the sound of the trickling water, being able to see the fish swimming through the pond, looking up and seeing the daylight and the bright blue sky. And in doing this inner sanctuary exercise, it can help to create a sense of calm in the body. So doing this, you can think of a place that you've been. Maybe you've been hiking up a mountain recently that really made you feel connected to earth, connected to yourself. Maybe it's when you've seen a beautiful sunrise or sunset. It can be a place that you've been to. It can be a place from your childhood. It can be a place that you've always wanted to go. It can be a place that you've created in your mind's eye. And helping to create a sense of calm during difficult times. So I've encouraged people to use this type of imagery if they're if they're even in the chemo room and they're undergoing chemotherapy. They might have the picture on their phone. They might listen to an audio recording of an inner sanctuary exercise. They might look at a picture or just visualize the picture and imagine going through what you can see using the 5 senses. What we've even done is a patient who had gone through surgery actually printing out a picture of her inner sanctuary and posting it in her room, in her hospital room, in order to be a reminder of, I have a place of comfort that I can turn to at any time. The inner advisor exercise is a wonderful one, and it's one that the Academy for Guided Imagery really, really encourages. And it's thinking about a person, a character. It could be fictitious, or it could be someone that you know, who resembles pure love, pure comfort, pure wisdom, so that in their presence you feel calm, supported, cared for. And so when people hear inner advisor, they might think of a wizard like Gandalf the Grey from Lord of the Rings. They might visualize the fairy godmother from Cinderella. Maybe it's a fairy. Maybe it's a spirit animal, an animal that represents something that's important to them, such as strength or power, or nurturing. And for me personally, my inner advisor is my stuffed animal bunny. So he's a big yellow bunny. I don't have a photo of him. I've just taken a yellow bunny from the internet because he is very, very tattered and worn. And actually my partner recently saw him hiding in the closet the other day and was quite terrified by the way he currently looks now. So no picture of him today, but he is someone that I will think about when I'm approaching a problem or I'm dealing with a difficult feeling or emotion. So something like abandonment, loneliness, anger, sadness, fear, overwhelm, all the feelings that might come up in relation to a cancer diagnosis, treatment, history. Maybe you're a caregiver and watching your partner go through all of this, or someone close to you going through this, and ways of being able to offer support. So what you'll do then with this image is you'll start to dialogue with the inner advisor and find out what you need to know about the situation and what would the inner advisor suggest for you to do. So again, although it sounds a bit hokey, you are coming up with your own resource. You are coming up with your own ways of support through the use of the inner advisor and using your subconscious and your imagination to come up with these things. And it can be really powerful, really comforting. What I will say is I did do this with a patient, and she had thought of her mom. And although it was positive in the beginning, towards the end, it actually created more anxiety for her. And so what we talked about afterwards is, if you're going to visualize someone who is not perfect, right? So someone who might have some criticisms, might have some judgment, then you're visualizing this person in their purest form. So they, at the core of themselves, that is pure wisdom, pure love. So if the inner advisor starts to get critical or judgmental, either A, this is not your inner advisor, this might actually be your inner critic showing up, or B, needing to work with this image and visualizing them in their purest form. The inner critic is when, and I'm sure we're all familiar with that, it's the part of ourselves that is very critical, puts us down, makes us feel like we're not enough, or that we're too much, that we won't succeed, that we can't do anything right. It's the part of ourselves that is really judgmental and critical. And so what you can do with this image is you can visualize what this inner critic actually looks like and start to dialogue with it. What does it want? What does it need? What does it need in order to feel more love in its world? What does it need to feel more support in its world? And seeing if in dialoguing with this image, you can provide more of things that it needs to yourself. Inner dialogue can be applied to any visualization, and I find this to be most useful. And it's when you're actually dialoguing with the image. So if you're dialoguing with a symptom that you're experiencing, maybe it's a sharp pain, finding out, what is the sharp pain about? What is it trying to tell you? What does it need to feel more supported or more regulated? It can help, you can find out about and dialogue with maybe a resistance of, you might be resisting something. So a lot of people talk about, you know, I feel depressed and I feel there's a sense of resistance in coming out of that depression. Well, let's find out what that resistance is about. Let's visualize what that resistance looks like and start dialoguing with this resistance. Maybe it's the image of an inner resource, the part of yourself that you need to get through a hard time, and dialoguing with this. Just reading a question. Can the inner advisor be yourself at a different age, perhaps? That is a great question, Francis. And yes, it absolutely can. So the way that I transform the inner advisor is actually transforming it into my wise self. And I'm going to give you some more information about the wise self at the end. It's not necessarily a strategy that's taught by the Academy of Guided Imagery, but it is something that I work with regularly, which is you yourself in a place of wisdom. Maybe it's yourself in older age, maybe it's yourself in another lifetime, but being able to offer yourself support. Absolutely, it can be used at a different age. Thank you for your question. And so in terms of that dialogue, just finding out more information and working with this image. So for a lot of people, they might want to know more about, well, why is the cancer here? What is its message for me? What does it need me to know? And I did an imagery exercise with someone this morning, actually, around this, you know, why is my cancer here? And in dialoguing with the cancer, she actually came to determine, I need to focus more on my own well-being and my own self, setting more boundaries, taking time off work if I need to for my own physical health, connecting more with other people. She acknowledged that she wasn't someone who often took care of herself. And so this was at the forefront of what her cancer wanted her to focus on. So Sandy, I see your question. I'm going to answer them towards the end if that's okay, just to work towards the rest of the presentation. So evocative imagery, if I can go to the next slide, there we go, is when you're visualizing yourself in a state where that you want to feel. So let's say you want to feel more calm or more relaxed. You'll bring to mind a time when you felt calm and relaxed. So for this gentleman in this picture, he wanted to think about a time when he felt more calm. So he thought back to a family vacation that he went on and a quiet moment that he had on the beach. Knowing that his family was still there, still in the background, but wanting to have that quiet moment of solitude. And so exploring this image, it's really wanting to create that sense of calm within the body and actually shifting the affective states. So the actual physiological, emotional, psychological well-being. And so actually feeling the sand under his feet, under his hands, feeling the warm sun on his face, and starting to turn up the volume of that sense of calm and the sense of solitude that might be helping to combat a stressful time, feeling isolated, alone, knowing that his family was right there, but that he was actually also okay on his own. So maybe you're thinking back to a time when you felt really physically strong, vibrant, healed, calm, relaxed. Can be really helpful. A healing counter image is when you're bringing to mind an image that is opposing what you might be currently visualizing. So for someone who is feeling immense worry in relation to an upcoming surgery, They described it as their heart feeling like it was surrounded in barbed wire and it was oozing. So a healing counter image would be starting to release that barbed wire. The heart is beginning to feel more full. It's starting to feel more vibrant. You visualize it in these playful colors, in movement, feeling fluid and open. So visualizing something that's countering what you might be currently experiencing. And a patient had talked about the actual shape of her tumor, and it was a frightening image that came to mind for her. And so in shifting what the tumor actually looked like, she started to visualize a flower, because that was less threatening. That was more of a helpful image to think about that didn't feel so frightening to her. Another patient talked about how she felt like her body after surgery looked like Frankenstein. And so working with a more healing image, which is along her scars, she wanted to get tattoos of leaves and flowers and things that made her feel really empowered and well and healed. So really amplifying that image for her. And to add another component, we imagined actually breathing into the foliage that she visualized tattooed on her body. So she was breathing life into the leaves and the tattooed vines and flowers. Process healing can be used during radiation. It can be used during or prior to surgery. So with a patient of mine, she had experience with Reiki, and Reiki is energetic healing. And it's visualizing, I'm simplifying, it's visualizing healing energy through the body, and it's coming out the practitioner's hands. And so because she was familiar with that, we talked about with the radiation beams actually being that healing white light that was laser focused on just where it needed to go. And that the rest of her body was covered in a healing blue protective force that was protecting herself from the radiation beams. And so this is actually using visualization, using imagery as you're going through something. And this can be used during surgery. A lot of people will use this during chemotherapy, of actually visualizing what the chemotherapy is doing, that it's going specifically to the tumor site and that the rest of the body is protected. So that is process healing. End state imagery is when you're visualizing yourself at the end of the challenge. And so the end state might not be when I am cured of cancer, but it might be when I have worked through all the fear that I'm feeling and still living with cancer, but that I've worked through all this fear. What do I look like at the end? This woman here, peaceful, content, relaxed. So visualizing that end state of what you want yourself to look like. Healed, vibrant, glowing, surrounded by friends and family, whatever image is going to be most helpful for you in terms of what you hope to achieve. So as you can see, interactive guided imagery can be used in a variety of different ways. It helps to be able to engage in problem solving, setting goals for yourself, resolving conflict. It helps to actually mobilize and utilize the healing response within the body. It helps to identify and utilize the inner strengths and resource that you already have within you. It just helps pull them out. And it helps to find more emotional balance and regulation. And as mentioned, these resources can be used at any time. It's very helpful to engage in a regular practice, just so that the imagery itself is more accessible to you. But ultimately, the resources are available at any time. So how do you do this on your own? It's a great question. I think learning about imagery first can be really, really helpful. And I'm going to tell you a little bit about a Wellspring exercise coming up, and of relaxation and visualization. So that would actually be a really great introduction that you can attend, and then think about how you can apply this on your own. But for the visualization piece, You can visualize these things at any time. So in times of stress or overwhelm, visualizing images that bring comfort. So using the inner sanctuary or that evocative imagery where you're visualizing yourself in a more relaxed state. Images that offer support. So the inner advisor might have some feedback in terms of suggestions of what you can do for your own healing. Maybe you're thinking about yourself in a more healed state. Or as Francis had asked, visualizing your wise self. So that place within yourself that is all wise and all knowing. Thinking about how you can engage in healing energy, visualizing that healing energy while you're actually going through medical procedures, or even in the waiting room, waiting for a medical procedure or a scan. And visualizing yourself in a place that is healed, peaceful, strong, that end state imagery. I think it's super helpful to be able to dialogue with these images. So investigating what the symptom, feeling, experience might be trying to tell you with a sense of curiosity. And also talking to your inner advisor, getting their feedback regularly of what they think about the situation and what they would suggest to help you cope during these things. So ways of being able to also engage in this on your own is engaging in expressive arts. So you might collage some of these images. You might actually draw out what these images look like and explore them as you're drawing them out. What I find, and especially for an introduction to imagery, is bringing to mind the image and then writing about it. So you can actually write from the perspective of your inner advisor. You can write from the place of your wise self. And I think what's great about writing is oftentimes, such as myself, people are nervous to engage in writing because they're worried about the emotion that's going to come up and whether they're going to be flooded. That's what can be so helpful about writing from the place of the inner advisor, where you're just writing about ways that you would support yourself, or even writing the dialogue with the symptom or feeling that you might be feeling. I will caution that imagery should be used with caution for anyone who has a diagnosis of psychosis, dissociative disorder, borderline personality disorder, or trauma. I know that many people would acknowledge that their cancer is a trauma, and it's not to say that imagery wouldn't be helpful. But if you are doing it on your own and you're worried about what might come up, it's best to do this with a well-trained and experienced practitioner. If you do decide to do it on your own, just making sure that you're pacing yourself. If you become flooded with a negative image, you can either bring in the inner advisor. You might stop the imagery exercise completely, and always making sure to just regulate yourself, offer yourself support, reminding yourself that you're safe. So we don't have a ton of time, and I do want to make sure that I still get to your questions, but I do hope to engage you in an imagery exercise. For the sake of time, I'm probably not going to guide you too deep in this exercise today, but I will invite you that if it feels comfortable, you can close your eyes, or just finding a gentle gaze in front of you, and just connect to where you are. Connecting to the breath, noticing any sounds in the room. And connecting with your breath just as it is, not needing to change it. Letting yourself settle. Finding a sense of comfort, relaxation in the body. And as we go through this exercise and this visualization, this imagery, this will not be with an interactive component. To not needing to say anything out loud. allowing your body to show up just as it is today. Relaxing the crown of the head, face, shoulders, arms. Relaxing the chest, torso, belly. Relaxing upper back, mid back, low back. Hips, pelvis, glutes. Arms, legs. Feeling yourself completely supported by the surface beneath you. And knowing that if a visualization becomes too overwhelming, to open your eyes at any time. Starting to visualize a challenging feeling or situation you've experienced recently. And in terms of overwhelm, selecting an image that's maybe at a 3, not too overwhelmed. Allowing this image to come to mind. Notice how it makes you feel in the body. Notice how it makes you feel emotionally. Does this situation have any message for you? Thank the image for showing up, and then let that go. Taking a breath and exhaling any of the feelings that came up. Bringing to mind your inner advisor. Whatever image first comes to mind that is wise, loving, compassionate, caring, supportive. Notice their facial expression. Notice their posture. Notice what they're wearing. Tuning into your own body. Notice how you feel in their presence. Tell your inner advisor about the situation you visualized. challenging situation or feeling. Tell the inner advisor how you're feeling. Notice the inner advisor's facial expression and posture in response to what you've told them. What wisdom do they have to offer you? What do they have to say about the situation? Notice how you feel in response to their message. Take this time to ask the inner advisor any question that you have about the situation. What do they say to you in return? What do you need to get through this situation? Does the inner advisor have any final messages for you? Thank the inner advisor for showing up today and for their guidance. Notice the more helpful feelings you might feel in your body, or neutral feelings. Imagine turning up the volume to those feelings. And before closing, taking 3 breaths in through the nose and out through the nose. And when you're ready, you can gently open your eyes, bringing yourself back into the room. So as the presentation comes to a close, if you would like more information about interactive guided imagery, you can visit the Academy for Guided Imagery website listed here. Give you a quick second to write it down if it interests you. Type it into your phone. And coming up at Wellspring is the Relaxation and Visualization Program. They run Wednesdays and Fridays, and the next one is coming up this Friday, 27th at 1 o'clock to 2:30. I really think that this would be a great opportunity to start if you're new to imagery, or if you even want to just enhance your skills, to be able to be guided through the imagery experience and then apply some of the things that we use today on your own. Thank you so much again for having me. It was such a wonderful opportunity for me to be able to talk about something that I'm truly, what's the word? Just truly excited about, and have definitely seen the benefit both in my own life and in the people that I work with in their life. So I hope that you've learned some skills today that would be helpful for you.